Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight we are going to start out talking about cholesterol, and then we'll get into general questions. Hi, Mom and Dad. Nice to see you. How are you?
Oh, it's nice to see you. It's nice to visit with our friends and our new friends. This is at 5 o'clock on Sundays, Pacific time, 5 p.m. Pacific time on Sundays is when we get a chance to get together, which is what it is right now. I got that right.
Yeah, you got that right. Yeah.
Thank goodness.
Okay.
Yeah, I want to talk to you a little bit. I want to talk to you a little bit about some things that are important for you to know. And we're going to take it little bits at a time. You know, I've been at this for, good grief, 48 years. So I can't share everything with you in an hour. Of course, I have some great books out there. Heather, what book are you have up for people for nothing, for free?
The
No
Healthy
gimmicks?
Heart book is free this week, starting tonight.
right.
So
Oh,
download
It was
that. And I'll share the
a
link.
big,
Yeah.
a big
Yeah.
seller, yeah. It is pretty much up to date, even though I published a few years ago. Nothing much has changed. And we've talked about that. We've talked about how they've done more studies on heart surgery, still no survival benefit. You know, not much has really changed. So let's see if we can get some slides up here. Today, in the New York Times, we started out with this particular question or statement: you should get your cholesterol checked. That's today's New York Times. So obviously somebody's concerned about cholesterol.
well, that was what it was for, is to get people interested in getting their cholesterol checked.
Yeah,
Oh, okay.
you know, it's critical. It says it's related to heart disease and other serious problems.
Okay.
You know, and that's what, you know, if you're going to say cholesterol. In fact, if I put the word cholesterol into Google, into images, I just get pictures of rotten arteries, which was, you know, the picture I was showing you. I
Yeah.
mean, you know, they took the trouble to show me the structural chemical formula cholesterol, but I know you wouldn't be interested in that. But, you know, it's so tied to heart disease that, or to artery disease that, you know, when you mention cholesterol, that's what people think of. But it's also tied to other problems. We'll get into it. Cholesterol is a risk factor for pretty much all the Western diseases, and there's a reason why it's a risk factor. What we're talking about is a disease that begins at about 8 months of age. Let me repeat that: 8 months of age. You see fatty streak deposits in little children.
I bet not if they were breastfed, though.
Probably not. No, there wouldn't be, Mary. There were kids from actually New Orleans that were studied.
Okay.
And by 2 years of age, all of them had fatty streak deposits. And you get up into the 20s and you're dealing with a disease that affects somewhere between 50 to 70% of people in their 20s, significantly. I mean, serious closures. And so that's what we're talking about. So we're talking about artery disease. I want to make something really clear to you. We're talking about 80,000 miles of blood vessels get affected by this river.
Oh, 60,000.
60, you're right, 60,000. 60,000 miles. Another 20.
Throw in another 20,000. What's the difference, right?
Maybe if you're overweight.
Maybe.
60,000 miles of blood vessels. This means it affects your arteries and your arterioles, which are smaller arteries, and your veins and your venules and so on, and capillaries.
So all these things.
Right, but when a major supply of blood is cut off, then the organ that lies distal to that flow of blood dies or is compromised.
Okay, you better explain distal.
Well, it lies distal, like here it is, and
It's beyond that.
beyond that. Thank you.
Beyond that. Okay.
All right, so if you close the arteries to the eye, you get something called macular degeneration. You close the arteries to the ears, you get tinnitus, vertigo, and hearing loss. Many of you know my history. At age 18, I had a massive stroke, and I deserved it too. Fortunately, I changed my evil ways, and I didn't end up having a heart attack or another stroke. You close the blood vessels to the major arteries, you get aneurysms. Close the arteries to the kidneys, you have kidney failure. The intestinal tract, it has a blood supply too. And if you close down the blood supply, that section of bowel dies. We call that a bowel infarction. And back pain is similar to angina. People get pain in their heart from low blood supply. But a lot of people out there that have back pain, it's because they have poor circulation to the vertebrae.
Okay.
And we're going to talk about somewhat about reversal of these things too. Close the arteries to the legs, you get claudication. That means you try and walk and it hurts really bad, hurts your calves and your thighs. And if you get a closure, really severe closure to your extremities, like to your legs, you end up having your feet die. And we call that gangrene. And you close the arteries to the penis and you become impotent. It's not due to a lack of interest. It's a matter of not being able to function, erectile dysfunction, they call it. Cholesterol. When you go to the doctor, you wonder whether you have heart disease or not, or you think about it. It was discussed in this New York Times article. They talk about all kinds of risk factors. Now, risk factors are not the cause of disease. They're just things that you can find that suggest that you're more likely to have a particular disease or condition. And it's really important you understand that, because the treatment of dietary diseases today focus on risk factors, not the cause. All right, it's really important that we establish that. And you hear of a whole bunch of things like, I have high cholesterol, I'm a high risk of heart disease, I'm overweight, I have high blood pressure, I'm getting older, I smoke cigarettes, and you just get so confused. And as a result, one of my good friends in the medical business, William Clifford Roberts, he was head of the National Heart, Lung, and Blood Institute, their pathology division. And he wrote an article, and it's worth your while reading it. What Dr. Roberts said is there is really only one serious risk factor, and that's your total cholesterol. And he says that because if you have a total cholesterol of less than 150 milligrams per deciliter, then the other things don't count. Well, age counts, of course. The fact that you're a man counts. But no, it doesn't even count if you're a man. If you still run a low cholesterol, you're immune from heart disease. Whether you smoke cigarettes or not, if you have a low cholesterol, and that is, you got it there honestly, then you're very unlikely to get heart disease. Same thing with high blood pressure, et cetera. The point being is that you don't have to be confused. You could just pay attention to one thing, and that's total cholesterol level. And that's the factor you need to focus on. And these other things, which either you can't do anything about, like your age or your sex, or really aren't a matter of worth your attention, like being overweight, having high blood pressure, and so on, because these are caused by the same thing high cholesterol is caused by. Same thing with diabetes. So instead of focusing on all these different things, having all these different things to worry about, it's important that you focus your attention on blood cholesterol. Cholesterol, they say, is only found in animal products. That's true, but if you want to play an I gotcha, you can tell people, no. There's cholesterol in plant foods too. And you go to the Journal of Chemical Education, volume 2005, and you'll find a chemist's discussion of the fact that plants do have cholesterol. It's in such an insignificant amount that it really doesn't make any difference. It's true to say that the significant part of cholesterol only comes from animal products. And you may have heard, that was the teaching in the past, that all you have to do is switch from red meat to white meat. You solve the problem because you go from high cholesterol to low cholesterol. That's not true. If you look at it in terms of weight, in other words, you weigh the food, that's true, sort of. You look at fish, it's 60 milligrams of cholesterol for 3.5 ounces, chicken 60, but pork and beef are high, as you've been taught. There's 70 milligrams of cholesterol. However, you don't eat food by its weight. You eat it based upon the number of calories you consume a day. Like, you don't consume a 5-pound diet or a 2-pound diet. You consume 2,000 calories in a day. When you look at it per 100 calories, what you find is fish and chicken have higher cholesterol per calorie, which is the denominator, that's how you eat, is by calories, than do chicken and pigs, which fools a lot of people. But the message here is it doesn't matter. These are all muscles of animals, whether they flap a wing or wiggle a tail or move a limb, they're all muscles of animals, and they're drastically different than plants. So simplify it again for you. You don't have to worry about one risk factor, and that's your total cholesterol level. And you only have to really worry about one source of that high cholesterol, which is the animal foods. The scientific study of cholesterol causing artery disease began, well, more than 100 years ago. This scientist, what he did is he fed rabbits high meat diets. Now, rabbits are at best herbivorous. Now they are herbivorous for sure. They're not omnivorous. And what he found is that when he autopsied these rabbits, is when he fed them a diet, contrary to the typical rabbit diet of meat, milk, and egg yolks, is they developed severe artery lesions. So one area of evidence that cholesterol is the factor we're looking at has to do with animal studies. The other factor is worldwide studies, epidemiologic evidence. What you find is worldwide, country by country, population by population, the higher the blood cholesterol level in that population, the greater the risk of dying of heart disease, of dying overall. And then the third area that evidence comes from is what happens to you and I when we change our diet. You see here, a typical person started cholesterol at 220 to 245, went on a cholesterol-free diet, dropped it to 165. Well, you know what a cholesterol-free diet is, right? That's a no animal product diet. And when he went back on the animal foods, raised his cholesterol for another period of time, several weeks. And you could do that. You've seen it, many of you yourselves, is that when you change what you eat, the animal foods, is you can change your blood cholesterol. So these are clinical studies. Now, you may wonder what the correlation is between your blood cholesterol number and whether or not your arteries are sick. And one thing you can look at is you can look at your total cholesterol and get a guess, an estimate of what the chances are of finding a significant lesion in your arteries, if you're, say, do an angiogram or an autopsy. If your cholesterol is less than 200 milligrams per deciliter, you have only a 20% chance of having significant lesions. This means 50% closure of the artery or more. If your cholesterol, say, 250, you have nearly half the chance, or 50% chance, of finding significant artery lesions. At a cholesterol of close to 300, you have an 80 to 90% chance of finding such lesions. So your blood cholesterol level will give you an indication as to what you're going to find when your body is studied in more detail. You can also get an idea of what your cholesterol is going to be based on your age. And keeping cholesterol as the stable factor here, a cholesterol of 210 milligrams per deciliter, which is about the average cholesterol. If they looked at a person's age and they look for moderate or severe lesions, as you get older, the chances of finding these lesions is greater. But as I mentioned in the beginning, you can't do anything about age. It just happens. So total cholesterol, this is the test that you need to get. It's cheap, $5, $10, at most $30 or $40. You can get it yourself by going to a laboratory. You don't even have to ask a doctor for it. And this number, as I mentioned, is really the only risk factor you have to pay attention to. Let me go back here a second. But when you get your lab test back for your doctor, there are a whole bunch of different things that are listed under cholesterol, like apolipoprotein A, apolipoprotein B, HDL cholesterol, LDL cholesterol, small size particles, large size particles, etc. What they do is they take this total cholesterol and they try and redefine it and see if there are more significant correlations with you getting heart disease. This kind of a mental exercise is nonsense. Total cholesterol tells you all you need to know. Now, what happens when you change your diet is the fractions of cholesterol, they change too. If you change your diet, your good cholesterol goes down. Why? Because your total cholesterol goes down. If you go to the doctor and the doctor says, hey, Mary, you did a good job. Your cholesterol went from 230 down to 150. But Mary, your good cholesterol also went down. It went down from, say, 55 to 35. And good cholesterol, you should have that higher. And Mary says, Doc, what do I do? What do I do to raise my good cholesterol? We eat more cholesterol. That's what does it, because good cholesterol is only a fraction of total cholesterol. Likewise with the lipoprotein A and B and the particle size and so on, these all correlate back to one number, and that's your total cholesterol. You don't need to know more than that number for you to take action. Not all mammals or animals that eat other animals develop problems with their arteries. Certain animals, let's take a couple that are familiar to you, deal with cholesterol very efficiently, like a dog and a cat.
So cute.
A dog and a cat. Now, people, they make all the cholesterol they need. Cholesterol turns into vitamin D, testosterone, estrogens, progesterones, all kinds of different steroids. And the liver does that. It makes the cholesterol. But it makes all that we need. I must stress that. It makes about 500 milligrams a day. In addition, the typical American eater will eat another 500 milligrams a day. Unfortunately, our livers are only capable of getting rid of about 500 milligrams a day. So if you take in 1,000 milligrams a day, that extra 500 gets deposited in your skin, your tendons, your arteries, your fatty tissues, etc., because you can't excrete it. So your conclusion is, well, I was born with the wrong kind of liver. I should have a liver like a dog and a cat. Or you could assume or come to the conclusion that you should not be eating like a dog and cat. Now, I want to emphasize again that cholesterol is just a risk factor. It doesn't cause heart disease. How do I know that? You'll want to look up these studies if you happen to be in the medical business and realize that we have a whole bunch of drugs that lower blood cholesterol, but they don't change your chance of dying, at least significantly. Now, that was the original idea. You just take care of the cholesterol and we cure people of artery disease. That's not true. It's the food. Cholesterol is just one identifying factor of the food, which is translated into what happens to your body. When you give drugs that only lower cholesterol, for example, statin drugs, there's no evidence of mortality benefit. Absolute risk reduction, 0.8% for overall mortality. Your PCSK9 inhibitors, $10,000 a year, 2 shots a year, no significant change in observed overall mortality. A new drug, they're just getting popular, bempedoic acid, no significant effect on stroke and all-cause mortality. Next drug, little or no effect on endpoints. Berberine, which is an herb that I've been telling you to take if you need to see a lower cholesterol. I mean, first your effort should be in changing your diet. But if you really need to see a better looking number, take the herb berberine. That will lower your cholesterol too. But that's not going to change your chance of getting heart disease, because the drugs just lower cholesterol. They don't take care of the problem. Here's the research. Next time a doctor tries to put you on a cholesterol-lowering medication, ask, do you have evidence that this will make my life better and or longer? I mean, good grief, you're spending your hard-earned dollars. You're taking risks of side effects. Don't you think you ought to know whether it works or not? I'd look up these studies. What you need to do is you need to change your diet. Here's the results on cholesterol on our patients in 3 different studies. In 7 days, we dropped cholesterol 22 milligrams per deciliter. That's comparable to what these drugs and herbs will accomplish in 7 days. In fact, I would put up a test against these drugs, and I bet we would outperform them. In a 2-year study that we did with Oregon Health and Science University, the cholesterol reduction was 19 points. But you need to understand, this was a 1-year study. That means the people maintained the diet we taught them for a year. And one of the complaints about our diet is, yeah, it'll lower cholesterol, it'll make you healthier, but nobody can stick to it. Excuse me, people who learn the diet stick to it. Why? Because the results are so dramatic in terms of improvement of health, and the food tastes so good. Another study in New Zealand showed a cholesterol drop, again, of 21 points in a year. So in 7 days, you drop the cholesterol 20 points. And you maintain that cholesterol drop for a year. And you bet you even do better. Okay, well, that's the lecture on cholesterol. There was also another article in the New York Times And I just heard, well, a couple articles. One was on March 17th, which told us that the best we could do is to cool the planet. And the reason is human beings continue to produce greenhouse gases. Have you noticed much of a change out there in your society? People changing, driving fewer cars. I know there is some little change that are being taken place, but not much, not enough. One estimate from the Royal Societies of emissions of CO2 stopped altogether would take many thousands of years for atmospheric CO2 to return to pre-industrial levels due to its very slow transfer to the deep ocean and ultimate burial in the ocean sediment. Surface temperatures would stay elevated for at least 1,000 years. Yeah, I know nobody wants to hear this. Nobody wants to hear that we have already put ourselves behind the 8 ball so severely that we have to think of some pretty drastic things to do. And what they're suggesting here is to cool the planet. Today, in the Washington Post, what they did is they went one step further. This is an opinion piece of the Washington Post, is that we need to re-engineer our weather. And they talk about adjusting the Earth's energy balance by, for example, using mirrors. Using mirrors. The reason I tell you this is, ladies and gentlemen, 20 years ago, when our first grandson was born, I didn't want any of my 7 grandchildren to say, "Why didn't you try harder, Grandpa? Why didn't you tell even your limited audience about what they could do to save our planet?" Maybe what I'm going to do is cause little or no effect. Are people going to change their diet? Well, I'm going to try. Because animal agriculture contributes to at least half the greenhouse gases. Am I going to work on you as individuals to change your diet? I'm gonna, because at least you'll feel better by the fact that you can reduce your CO2 production by 80% overnight. But I'm also going to show you one other thing that they talk about in today's Washington Post, which I've been talking to you about because I am so concerned. And that's the MIR project. Write it down. I've asked you to do that. You're going to listen to a lecture from me on cancer, diabetes, etc. Then I'm going to at least occasionally remind you that we're not done yet. Okay? We can save our happy home. I don't ever want my grandkids to say, "Grandpa, why didn't you try harder?" This is my effort. It's to convince this viewing audience that we can make a difference. And this is an effort we have to make. That's the MIR project, which builds mirrors that cost $10 a piece, are made out of plastic bottles and aluminum cans. In Freetown, Africa, they've already done an experiment where they show they can cool this particular local area by this MIR project. Go to mir.org. All right, Heather, I got my little pitch in there. I know this offends a lot of people. You don't want to hear, there was a time when people didn't want to hear the diet. They had to change their diet. That was 20 years ago. Well, this is another thing that people don't want to hear about. But we've got some serious problems and we're not done yet, but we have to take some action. And the Washington Post today said, MIRS is the way to go. That's the geoengineering that's safest and most effective. Share it with your friends. All right. Now we'll get down to the serious part, which is helping you have a better life.
And the many, many questions that have been coming in. Thank you for sharing that on cholesterol. And just to repeat, the McDougall program for a healthy heart is free as a download all this week on our website, and the link is in the notes. Okay, let's see, questions. You did, I think, touch on this a bit, but to be clear, getting your cholesterol down to 150 with medication is not what you're asking people to do, right?
Yeah, thank you. Thank you. You make me feel like I did a good job of communicating. You can cheat, okay? Well, that's what drugs are. They're cheating. It's just like if you get a great big A+ on your report card, you might have learned the subject, but you could also copy from your neighbor. It doesn't necessarily mean that you've taken care of the issue based on this whole cholesterol number. if you got a cholesterol 150 or less, based on healthier dietary habits, and that means a starch-based diet, then yes, it translates into little or no breast cancer, little or no colon cancer, no type 2 diabetes, no obesity. Good grief. And what are we talking about? We're talking about the food. So you're right. You hear it correctly. And where this came from, I think I was the first one that ever suggested the number of 150 milligrams per deciliter or less is what you ought to strive for. With diet, I never said with drugs. Well, maybe I did a little bit. With diet, it's based on the Framingham data, Framingham, Massachusetts, where in their population of people, they found that if you run a cholesterol 150 or less, which was back before we had the cholesterol-lowering drugs in any popularity, you were essentially immune from heart disease. So yes, you must get this honestly by stopping the problem, which is the animal foods. Now, there are lots of other toxic things to the diet. Oil, we talked about that. We'll talk about it more. Refined food is not ideal. But the major poisons are animal foods and oils. And if you're dealing with cholesterol, I can lower your cholesterol, by the way, by feeding you vegetable oil. This was done in the Finnish hospital study and the veterans study. There are two big hospital studies where they had their patient population captive. They could control everything they ate, and they changed them from animal fat. This was after the Ansell's Keys work, the 7-country study, which implicated animal foods, cholesterol. You see, when I say animal foods, I'm saying cholesterol. Anyway, Ansell Keys' work came out in the 50s and 60s, which made this correlation. And from that, they started some studies to try and prove it on a clinical basis, an experimental basis. And what they did is they set up the Finnish Mental Health Hospital study and the Veterans Administration study, and they switched the people from saturated fat to polyunsaturated fat. They switched them from animal fat to corn oil. Corn oil is what we call an omega-6 fat. In other words, the double bond is at the 6th position rather than the 3rd position. So that's the oil they chose. Studies just published in the British journals show that those who were put on the vegetable fat diet ended up having worse artery disease than those who stayed on the animal foods. Why? Because these again, this is another way of cheating, except it's a more dangerous way of cheating than using these drugs. There's less expensive too than many of them. But that's another way to cheat, is to add vegetable oil, especially in the form of omega-6s. Omega-3s, they reduce your risk of dying of heart disease, but it's because they thin the blood. Okay, that's why you take omega-3, so you don't get a blood clot. Well, they thin the blood every place. So if you get in an automobile accident, guess what? You're more likely to bleed to death. So, there's also other negative effects of these vegetable oils, like they suppress the immune system. So again, you don't want to focus on animals of any source. And likewise, you want to have whole food. Corn's great. Corn oil's not so good.
So now we need some cholesterol, right? But it's my understanding that we make all of our own cholesterol. Isn't that right?
We make about 500 milligrams a day. And it's converted by the sunshine into vitamin D. And by the liver, it's converted into our sex hormones, testosterone, progesterone, estrogens, so on. And there are many other places, this steroid molecule. Cholesterol, it's a steroid molecule, just a ring structure. It doesn't matter too much to many of you. But there are simple conversions that take place. Well, on the skin, it's sunlight and vitamin D. In the liver, it's producing these sex hormones. So, but you have to have the basic precursor, which we can make from plant sterols. So we eat plants, we convert plant sterols into cholesterol, which is further metabolized into what I mentioned, vitamin D and sex hormones, and many other things in the body too. So yeah, your body does fine. And that should give you confidence that you do not ever have to eat cholesterol. I can't think of any reason to eat cholesterol unless you're starving to death.
Okay, thank you. Let's see. I think that's it about cholesterol. Now, let's see. Southern Magnolia wants to know. They went to see their cardiologist. They told them to stop eating wheat because it's inflammatory. What's your opinion on this?
Not true. There's an article I wrote, I think it's January of 2006, newsletter. It's about smoke and mirrors behind Grain Brain and who's Barry Sears?
Wheat belly.
Wheat Belly. We have Wheat Belly and Grain Brain. Smoke and mirrors behind Wheat Belly and Grain Brain. And they focus on the idea that plant foods cause inflammation, a subclinical inflammation that, diseases your arteries and your cells and so on, gives you all these diseases. But if you look at the research, which I challenge you to do, go to that January 2006 newsletter. I cited the research up until that time, which shows you clearly plant foods are anti-inflammatory. Now, why are animal foods inflammatory? It's because they're toxic and they damage the tissues. And the response to damage and injury is inflammation. If you burn yourself with a match, it heals by inflammation. If you hit yourself with a hammer, it heals by inflammation. That inflammation is how the body heals. It's classic, characterized by swelling, redness. You've noticed that when you burn yourself or hit yourself with a hammer, pain, and heat. Those are 4 characteristics of inflammation, and it occurs as a consequence of injury. All right, it's just like cigarette smoking causes damage by an inflammatory process with the body trying to heal from the cigarette smoke. Well, what do? You take anti-inflammatory drugs like steroids or the new drugs that they advertise in the market. There's got to be a new supplement down the line coming. Or do you stop smoking cigarettes? Yeah. Well, Mary, people, I went through the phase where I was taught, or the rumor was, that you just take these antioxidant vitamin pills, you can continue smoking.
Oh, yeah.
Because they're anti-inflammatory. Well, when they tested like vitamin E, which is high in wheat, vitamin E, when you gave it as a supplement, it actually increased the risk of heart disease. So again, we have to be talking about whole food. We've got to be talking about nature's creation over the last 400, whatever, long time. So, well, I don't know. I have to look up how there are different estimates of evolution, all over from 6,000 years to 400 million years. You choose. I don't really care. I know what causes the problem. Whatever you believe, it doesn't matter to me. But it's self-induced because of dishonesty and lack of correct knowledge. But you can get that knowledge. That's what we do on this show every Sunday at 5 o'clock Pacific time. Is I share with you what the science says. I am a scientist. I don't work based on rumor or the message from drug detail people. I work from the research. And when you look at the research, you will not find it contradictory. If you do, I can explain to you how they cheated. In other words, you say, well, statins lower cholesterol. Yeah, fine. But what do you care if you die with a cholesterol of 110 or 310? You just don't want to die. But if you have a cholesterol of 310, it indicates that you had damaging behavior. Now, it doesn't always occur. It's just a risk factor. It's just a suggestion. Just like being overweight, it's a suggestion. There are people I've taken care of over the years that have what would be called deadly cholesterol levels by some doctors. Cholesterol level of 350. Normal cholesterol, average cholesterol is like 210, 215. Ideal cholesterol, I've established, or at least I make as a goal, for those of you who need a great big A on your report card, I put that as 150 milligrams per deciliter. But when we studied these, there were 2 women that I studied, and we did 64 scans, heart scans, 64 slice heart scans. I mean, this is a detail close to an autopsy, and we found their arteries baby clean. So you may get depressed about having too high a cholesterol, but take the correct action. Well, let me add one other thing. Dean Ornish, who you must know about, he showed and was published in the major medical journals to reverse atherosclerosis by feeding a almost no cholesterol diet. But what Dr. Ornish found was the correlation between success in terms of reversal of artery disease was not related to what happened to the cholesterol. It was related to how well the participants adhered, complied with the program of eating. So anyway, it'll take you down a path that will result in not the outcome you deserve by just following blood cholesterol level. You'd end up in a doctor's practice where they give you a bunch of pills and a bunch of excuses, rather than what you need to hear, which is, all you got to do is eat potatoes. You fix the whole problem. Just eat potatoes, sweet potatoes, or bread. Bread, pasta. Bread is the staff of life, ladies and gentlemen. Did you forget that? The staff of life. Somebody must have liked bread. Thought it did okay. I mean, especially in the time in history when there was no such thing as heart disease, except among the royalty. And I can go back 4,000 years to the pharaohs, and I can show you that the mummified remains of pharaohs that lived 3,500 years ago, 4,000 years ago, when we do either ultra-fast CT scans or autopsies on these mummies, we can find atherosclerosis, terrible artery disease comparable to what Americans get. Why? Because mummies are rich people. They're the ones that ate all the rich food, whereas the people who built the pyramids lived on wheat and barley. So, this is a disease that goes back pre-smoking times. Nobody smoked back then, not tobacco anyway. It goes beyond the issues of not getting enough sunshine, stress. There must have been a bit of stress with all the battles that went on and diseases and so on back in those times. It's a food. It's just a food. Just fix the food. I can't emphasize that enough. Here, all these doctors are out there getting 7, 8, 9, 12 years of education, and all they needed to hear was just tell the patients it's the food. If you really want your patients to do well, tell them it's the food. Anyways, it's the food.
Thank you. It helps to hear it over and over again.
And it's, the thing most people don't understand, Heather, is how easy this is. And that's part of the problem. It's easy. And there's no profit behind it. People want Star Wars medicine. They want a pill to fix them. Not our listeners, but the general population. They believe in technology, chemistry labs. Monsanto's going to solve all the problems in the world. You're following
They're continuing to make more and more drugs. I mean, look at all the drugs you had listed that are coming out that are new for cholesterol. So they're not just stopping, they're continuing to make more.
All you have to do to get approved for cholesterol lowering medication is to, number one, not kill your patients immediately. And number two, show the blood cholesterol comes down. That's it. Okay, if the patients don't die within the period of time of the study, you get approval. I know I'm exaggerating a little bit, but it's almost that
Not
bad.
much.
I can assure you it's that bad when it comes to diabetic medications. In fact, the FDA made the drug companies come out and establish some other benefit of diabetic medications, blood sugar lowering medications, besides lowering blood sugar. In 2008, the FDA told drug companies and doctors that you need to invent drugs that improve people's lives, not just have them die with low blood sugars. You think I'm exaggerating? No, it wasn't that time.
You're not. Okay, let's see. Carlos is wondering, what should our percentage of fiber be when we're eating the McDougall program? Do we need to worry about that?
I don't know. What I'm asking, this is Carl.
Carlos.
I'd ask Carlos, are you talking about percent of what? Fiber has no calories. So it's percent of calories that are offered by fiber. They don't offer any calories. You can only do that by weight and weighing the food. And you see what a component of the food is not digestible. And we call that dietary fiber. Our diet, well, the typical American diet, when you eat carbohydrate, you're eating somewhere between 8 and maybe 16 grams of dietary fiber. On our diet, you switch to a diet that contains 80 to 120 grams of dietary fiber. It's naturally built into the foods. Plants make sugar. Plants convert sugar into starch, which is what we need to eat. Plants also convert sugar into non-digestible chains, which are called dietary fiber, which are really important too. I mean, they keep the nutrients from flowing into your bloodstream too quickly. That's how you get a bowel movement that's decent, is you eat a high fiber diet. But again, that's the type of thing where you can fix your bowel movements by taking fiber pills, but you haven't fixed the problem. You know, the average American, let me tell you what the average American, I've seen data that shows over the age of 60, the average intake of medication is somewhere between 6 and 12 pills a day. So it's a very successful business getting you on drugs. Getting you well, not so good.
Thank you. Okay, let's see.
I didn't really answer Carlos's question. I've kind of tell him I can't answer that question because percent of calories has to be based on something. And in the case of fiber, there are no calories in it, so you can't use that type of conversion.
Well, he had another question about white rice versus brown rice, and I think he was worried about maybe he's not getting enough fiber if he's eating more white rice.
You know, well, it's better to eat brown, but it's not a deal breaker. As I told so many people is, look, I want you to switch to a starch-based diet. The reason I say it's not a deal breaker is because when we look at data, I can show you the data, 2013 in JAMA on the Chinese population. In this article on what's happened in China as they become a wealthy nation, is that they have, since 1980, developed a population where obesity is common, where 12% of the people have frank diabetes and half are pre-diabetic. In 1980, what happened was they switched, not overnight, but as a population, from white rice to the American diet. That's the only change that took place. That's significant. So, you know, and 90% of the diet before 1980 was white rice in Asia. 2 billion people successfully lived on white rice. But what do I tell you? I tell you, look, if you're going to argue about this, eat the white rice. All right. If you want to do a little bit better, eat the brown rice or maybe a little mixture. Yeah. I know you think, I would guess you think that fiber is something like the bristles of a broom. I mean, that's what you think about fibers, right? Don't you?
Yeah, I think so.
Yeah. And you think, oh, it's scratchy in my intestine. I scratch all. No. That's not what fiber is. Fiber is microscopic, non-digestible sugars. I think the best way to demonstrate to you what fiber is take a potato, bake it thoroughly, and stir it up. After you're done baking it thoroughly, stir it up in a glass of water. Do you see bristles of a broom in there? I don't think so. No, you can't see the microscopic molecules. They're soft. They're just non-digestible sugars. So, you know, maybe you'll kind of get that analogy in mind. This is not bristles of a broom. Yeah. What? You lost
Thank
something,
you.
Heather?
Nope, I'm all good. I'm just trying to get through all the questions. There's so many. Okay, this one's from Rhonda. She's worried about heart disease because she's had insomnia for 20 years. She's been to 4 doctors, no help. What would you suggest?
Well, you certainly need some sleep for rest. The question is, how much do you need? You know, it depends on your stage of life and your condition of health. If you sleep too much, you get depressed. We talked about that. If you sleep too much, you develop insomnia. We've talked about that. What is the ideal number of hours of sleep that adults should get? 6 to 7. Why do I say that? Because the greatest longevity is found in people who get more than 6 hours, but fewer than 7 hours of sleep. Now, that depends upon your age, too. Babies need maybe 14, 18 hours of sleep. Pregnant women need more sleep. Sick people need more sleep. So, you know, the idea that you sleep too much is going to give you heart disease, I don't see the correlation there. If you sleep too much, you can have a less productive life. you have a greater chance of becoming depressed. In fact, you have we're not going to give that lecture tonight, but you can look at my March 2004 newsletter, and you can see how sleep controls your mood. If you get less sleep, you tend towards mania. You get too much sleep, you tend towards depression. March 2004 is the newsletter.
Thank you. Okay, next question. Let's see. There's so many. I'm sorry, I'm not going to be able to get to them all. CJ has been eating mostly plant-based for a while now, but just got their blood test, and it says their blood sugars are slightly high, so they've got pre-diabetes, and their iron is low. What would you recommend?
Give up the dairy. No. Okay, I would first find out why the hemoglobin was low. The first thing you have to look at, and this is any standard doctor's care of a patient. Every medical student knows this. The first thing you do is you look for a source of blood loss. And there are two sources of blood loss that may go unrecognized. And they would be blood that forms the intestinal tract. It's mixed up with the stool. You sometimes don't see it. And the other thing is women may menstruate heavily and lose a significant amount of blood. But, once you've taken care of the bleeding issues, of course, you need to cut down on the heaviness of menstrual flow and the days of blood loss. You do that by changing to a healthy diet. What you need to do next is you need to ask, well, what foods would prevent iron from being absorbed, which would cause me to get iron deficiency anemia? Well, dairy is the number one, because studies done on, well, most of them are done on children. Most children are on milk. If they develop iron deficiency anemia, we call it Heiner's syndrome, and it's not corrected by, you give them iron pills, blood transfusions, a whole bunch of things. You can't fix the problem until you take them off the dairy. The dairy contains calcium and phosphorus. Both of these elements will complex with iron and form insoluble complexes. So if you eat iron in the form of beef or green beans, if you drink milk, cheese, etc., what happens is the calcium and phosphorus complex the iron in these otherwise high iron foods and lead to iron deficiency anemia. But first, look for a source of blood loss. That's just standard medicine.
And then what I would say is I'd find out if they're eating a mostly plant-based diet.
Yeah, right.
Well, how much is mostly?
Well, what does a progressive vegetarian eat? What does a flexitarian eat? People call them flexitarians, and then they become they become pesco vegetarians or pollo vegetarians, which is just a little chicken and fish, or you become a vegetarian, which is cheese and eggs, because you didn't kill any animals. And then, of course, you follow a pretty good diet, which is a vegan diet, but that's not quite it, folks. Now, you really don't have the direction you need until somebody teaches you that your diet is starch-based. You need to make the bulk of your calories from foods that have been traditionally eaten throughout all of human history that we can verify. And these are starches. Starch. You can't survive on broccoli or kale or lettuce. It ain't going to work. You need to have a source of calories to power you through the day. And that comes from plant parts that are high in energy. And these are called starches. I know you're afraid of starches. The propaganda, the brainwashing that's going on is so immense. I understand that you have a problem. Everybody knows starches are fattening. Starches, like rice, they turn to sugar, and sugar makes you fat. And that's why there are 2 billion Asians who are fat on white rice. You say, wait a minute. I remember there weren't any Asians fat, and they were eating white rice. So the idea that starch turns to sugar, which turns to fat, there's got to be a flaw here. Because if there wasn't a flaw, I would see just the opposite of what I observe. All right, it's very difficult for the body to turn sugar into fat. And we go through that in another lecture. Which, by the way, if you need a rapid education, go to YouTube. I must have 200 lectures up there. And look up in the Google,
least.
you know. And I know the material needs to be repeated, and maybe in a certain way I'll say it to you that really makes a difference, or you'll hear it enough so you say, hey, you know, this sounds okay. You know, this is not so radical. You know, radical is having heart surgery or having your breast amputated. You know, that's radical. Eating potatoes and sweet potatoes and rice and corn, that's pretty okay, I think. I know. You were taught about a whole bunch of deficiencies, right? Well, that bit of propaganda came from the meat and dairy industry. They teach you need meat and eggs to get protein. And they teach you you need to eat dairy to get calcium. Excuse me, ladies and gentlemen, do the research. There's never been a case of dietary calcium or protein deficiency ever reported on any natural diet in all of scientific history. Never happened. But you better be worried about it. You better make sure you get enough meat and cheese in your diet. And you know, as a flow on of this idea, to continue the thought pattern, well, calcium and protein are the only nutrients I really need to focus on. If I get those, I don't have to worry about anything else. Excuse me, what you need are vitamins and minerals. Of the 13 known vitamins, 11 are made by plants. They're vital amines. Vital, you must get them from the food. 11 or 13 made by plants. One is not a vitamin, it's a hormone called D, and the other is B12, which comes from bacteria. Boy, are you interested in what we do every Sunday night at 5 o'clock, right? Pacific time, because we're going to bring out a whole bunch of contradictions. But I'm not just going to say these things to you. I'm going to show you the evidence, because I know you're concerned about yourself and your family. I know you want the truth. You're being lied to. I probably shouldn't say that. What I said, people are exaggerating the truth for money. How about that? People are exaggerating the truth for money. They're liars. That's why they're doing it. It's for money. You know what? All right.
They're misleading.
Thank you, Mary. This is my political correct component over
There you
here.
go. Yeah. That's why
He
you got
corrects
mom. Okay, let's see. We've got a few minutes left, so we've got time for some more questions. This is from Freethinker52. They've been on your diet for the last 15 years. They recently got a calcium score of 116, and their doctor now wants them on Crestor. What do you think?
Yeah. I think that you're looking at past events. The problem is that prior to 15 years ago, you ate the Western diet like I did. And I told this story, but I'll try and repeat it in as short amount of time as possible. When I was about 35, my brother's a physician. He had a heart scanner in his office. And so we had opportunity to get free scans. They're usually, you know, at that time, they're a couple $1,000s. And so Mary and I got heart scans done. And the technician called Mary in first for the reading and said, "You're great. You're great." And then she called me and she said, "You better make your next appointment with a cardiologist for the cath lab." Well, you know, I've started thinking about it, and I said, "Yeah, you know, I damaged my arteries a lot. Good grief, I had a stroke when I was 18. I still walk around with a limp 58 years later. I know my cholesterol is high. I got my blood cholesterol in the past. It was 338. I know I lived on eggs and beef and pork and chicken. I mean, I know why I got a high cholesterol, and that caused damage, which turned into scars, which don't go away. Those scars stay there. So does the calcium. But if you change your evil ways like I did, which would be over 40 years ago, you know, up until recently, I was windsurfing at 35 miles an hour, you know, for 3 or 4 hours at a time. No chest pain. So I have to say, I caught it in the bud just in time. That's what the doctor should say to you, is you got a calcium score of 119, and we discovered this, so you better catch it in time. But you don't catch it in time taking Lipitor or whatever, Crestor or whatever, statin. I just showed you the data on statin a couple of minutes ago. I gave you the references. Go back on the discussion I just talked about. Look up the research. Doctors were really enthused about the correlation of cholesterol to artery disease at one time, 30 years ago, 20 years ago, maybe even 5 years ago. They're not anymore, because they realize what I'm trying to share with you is a low cholesterol number doesn't really cause you to live longer if you got it by statins. If you got it by a good diet, it does, but not by statins. I always try and give you the research in the bottom right-hand corner of the slide. It takes me a lot of effort, which I enjoy, by the way. Mary reads novels, I read medical studies. And I do that because you're looking at people, maybe you don't know them very well. You don't know the results of their program, which have been running for 48 years now. And, you have some doubt. Well, look it up. The internet is an amazing tool. And then go into the doctor and say to the doctor, okay, can you give me the research, the one that puts you on Crestor? Can you give me the research that shows that I'll be better off taking this statin than not taking it? Better yet, doctor, can you show me that you can reverse calcification on my heart scan? Can't do that either. They've tried. Believe me, the people who make these statin drugs have done multiple studies trying to show that you can lower the calcium score by giving Lipitor, Crestor. It doesn't. Why? Because scars are scars. Happened a long time ago. I damaged my arteries, no doubt. But I found out what the problem was and I stopped doing it. So the answer to the question is, yeah, you did some bad things when you didn't know any better. But now you know better. You've known better for the last 15 years. And so how could you confirm what I say is true? Well, you could get serial CAT scans. Well, you can't because 15 years ago you changed your diet. So that won't work. You can't. You just have to go by faith. Go and run around the block and see whether or not you get chest pain. That'd be a good way to test it. And I would guess you're kind of at my age where a little exercise, if you really had bad arteries, would show itself. Chest pain, at least, if not more other problems.
Thank you. Okay, this next question is from Miguel. Can a patient with a bicuspid aorta valve with aortic stenosis benefit from the McDougall program and possibly avoid heart valve replacement surgery?
Well, I can't answer the last question. Which valve was it, the aortic valve or mitral valve?
Let's see. Oh, sorry.
Irrelevant. Let me tell you this to answer the question she wants. You were born likely with this bicuspid valve instead of tricuspid, which is in the aorta. I should know better. I think it's in the aorta. It's been a while, folks. Anyway, tricuspid is the aorta, I believe. And the bicuspid is in between the ventricles and the atrium. Anyway, you may have developed, that's right, Heather. You remember? I wish you'd gone to medical school so you could remind me all these things. Anyway, valve disease is caused by poor blood supply to the valvular leaflets. And so it's small artery disease that results in these valves being compromised. That's one reason. There are other reasons like autoimmune diseases, rheumatic heart disease, infections, bacterial endocarditis. I mean, there are many ways to get into valve problems, but the most common way is the result of the most common thing people do, which is to eat a diet that closes down the arterioles and the capillaries. Remember I told you 60,000 miles, 60, right? 60,000 miles of blood vessels. Those are also the vessels that supply indirectly the circulation to the bicuspid valves. Anyway, that's how you get the disease. Now, another thing I was going to add, they have a couple of different ways, and this is, again, a whole business deal. We typically did valve surgery by making a cut in the chest through the sternum. And in the early days, I'm not going to talk about them anymore, but recently they've been putting valves from pigs and cows. They've been inserting them, and they've found a new way to do it, which is to it's a trans-aortic placement. And what they do is they go through the leg artery, and they go in with a catheter, and they place the valve in without even making any cuts in you, except a little cut down in your leg, rather than splitting your whole chest open and putting you on the heart-lung machine. But the business part of it is this: there's a tremendous amount of argument going on between the various factions of these two types of treatment. And you would think that they'd come down to the conclusion that one or the other is better. Good grief, to me, it sounds pretty darn simple to choose one where they don't cut a big hole in your chest. But sometimes that's not possible. And sometimes you walked into the wrong doctor's office. You walked into the doctor's office who's only learned how to do the open heart surgery. Whereas you could have walked into a thoracic surgeon's office that does the aortic approach. And that's why you get second opinions. That's why you do a little reading on Google and the National Library of Medicine. Like if you looked up this, what I just talked to you about, different valve replacements, you would see that this is a ripe argument that's going on. I mean, this is hot. This is money.
Okay, it's 6 o'clock. That hour went by so fast, as always. Thanks,
All
Mom
right.
and Dad, Dr. McDougall and Mary.
I want to just kind of remind everybody, 5 o'clock Pacific time, Sundays we're here most of the time. Sometimes the problem comes up. Next month, we're going to do a series on the GI tract. And for people who are followers of ours, in other words, you take the newsletter, Instagram, or however else you get on the mailing list, the admittance fee is nothing. I'll be spending half a day with you to talk to you about problems from the lips to the other end, gastrointestinal problems. And we're going to do that on May 10th or 8th.
Oh, May 10th is the start of the program.
Oh, we're going to do it sometime, I think next month. So you want to get signed up on one of our mailings so that we can let you know about what's going on. And we're full for this program, the one that starts in May. So if you want to get, I guess July is starting to fill up. And
It is.
Heather tells me she only lets a certain number of people in. Heather, these are people, they need their patience. They need our help, and you can get the help immediately. I want to stress that. The day you decide to spend 12 days with us is the day or shortly afterwards that you meet Dr. Anthony Lim, who's our medical director, and he will talk to you about what you're in for and what we think we can accomplish in terms of your health or return of your health. And it's not free. There's a consultation charge. If you decide to come to the program, consultation charge is a part of that fee. If you don't, you spend an hour or so with Dr. Anthony Lim, which is probably the best medical visit you've ever had.
Okay. That was a great
All
hour.
right, Heather.
See you
Thank
all
you.
next Sunday at 5 p.m. Pacific.
Yeah, you were great, Heather, as always. Talk to you
Thanks, Mom
later.
and Dad.
All right.
Bye, everyone.
Bye-bye.
Thanks for tuning in.